Most of the epidemiological studies suggest that ADHD is a very common disorder present among 5% of the youth, including children and adolescents, and about 2.5% of adults. I'm Dr. Ashima Shrivastava, a senior consultant clinical psychologist working with Max Super Speciality Hospital, Patparganj. I'm here to share my views on this important topic, that is ADHD. ADHD is a common neurodevelopmental disorder which is present since childhood and is associated with the symptoms like inattention, hyperactivity, and impulsivity. The manifestation of the symptoms takes place in different situations and may vary from person to person. Inattention is characterized by having difficulty in paying attention to the task in hand, leaving the task incomplete, and having difficulty in following the instructions and a tendency to lose personal belongings quite often. Hyperactivity is characterized by having difficulty in being seated in the chair, having difficulty in following the instructions, and also being very fidgety, squirming, and the person may be felt as if he's on the go, and also he may be driven by a motor. And impulsivity is characterized by having difficulty to wait for the turn, intruding into other person's conversation, and also blurting out answers before the question is completed. Some or all the symptoms of ADHD could be present and could be primarily in terms of inattentive type. The other could be combined type, including inattentiveness, hyperactivity, and impulsivity, and the third could be only hyperactivity and impulsivity. 6 or more symptoms of inattention should be present for children till 16 years of age and above, and 5 or more symptoms should be present for adolescents age 17 and above. 6 or more symptoms of hyperactivity and impulsivity should be present for children up till 16 years, and 5 or more symptoms for children who are adolescents for age 17 and above. Also, another important criteria is that these symptoms of inattention, hyperactivity, and impulsivity should be present for a minimum duration of 6 months. Also, they should be evident in more than one setting. Also, there is a clear evidence of these symptoms interfering with the routine functioning of the child in the area of school, work, and social life. Also, these symptoms are not better explained by any other mental disorder. Epidemiological studies suggest that ADHD occurs in 5% of the youth, including children and adolescents, and 2.5% amongst adult population. It is more prevalent among boys as compared to girls, with a ratio of 2:1 in children and 6:1 amongst adults. In addition to inattention, hyperactivity, and impulsivity, there are other associated conditions which could be evident, like a child may have difficulty in controlling their anger, they may have irritability, lability of mood, they may have low frustration tolerance, conduct disorders and related symptoms like bullying, disobeying the authorities and disrespecting the parents, running away from school. They may develop the habit of abusing substances or consuming alcohol. There are gross deficits in terms of their social skills. They have a difficulty in initiating and maintaining social interactions with others. There are other associated motor and sensory issues which are evidently present. The child may have issues with fine motor skills and gross motor skills, like carrying out skilled activities, for example buttoning up the shirt or tying shoelaces or drawing, and other associated symptoms could be present in terms of sensory issues. The child may be under or over responsive to the information which is received through different sensory modalities. There are other associated symptoms which are evident in terms of poor cognitive functioning. The child may have deficits in the ability to process the information which is required to complete a particular task in hand. Their speed of processing the information is slowed down, because of which they are not able to catch the instructions in the class and they are not able to complete the task in hand. Other issues could be Poor organizational skills, they may exhibit difficulty in organizing routine skills, which would mean that they have a difficulty in putting their belongings to a particular setting, or managing their school bag for the next day routine. There could be deficits in terms of memory functioning. They may have difficulty in encoding, retrieving and recalling the information which is there, which is needed to be stored in the memory functioning and which is required to be recalled for the later. Several neurotransmitters and chemicals have been associated with ADHD. Children who are born prematurely or mothers who had history of infection during pregnancy and brain damage and head injury are likely to be associated with ADHD. Perinatal insult to the brain during infancy, out of the reason could be in terms of infection or inflammation. They're also likely to cause ADHD symptoms. Maternal smoking during pregnancy is likely to cause hypoxic injury to the brain, and maternal use of alcohol during pregnancy. There has been studies which says that refined sugars, they have direct impact on the behavior of the child. Lack of omega-3 fatty acids also have association with ADHD symptoms. Apart from that, family adversities is a very common factor. Children coming from adverse family conditions wherein there has been history of violence, they are likely to grow up with ADHD symptoms. Bullying during the childhood, the child learns maladaptive coping mechanisms and is likely to grow with pent-up emotions, which finally gets manifested in the terms of ADHD symptoms. Apart from that, there is a very important factor which is predominantly present is authoritarian parenting. Children who belong to families wherein parenting is authoritarian in nature, they tend to grow with ADHD symptoms. There are different treatment modalities which are available to treat children suffering from ADHD. To begin with, first is psychosocial approaches which make use of behavioral techniques, and by making use of behavior modification, they try to work on treating the undesired behavior of the child and reducing the problem in the behavior by making use of different behavioral techniques like positive reinforcement, wherein we try to encourage the desired behavior of the child by reinforcing it positively by introducing the rewards. Timeout is another important technique. Apart from that, social skills training is integral part of the treatment, because children with ADHD, they lack a skill in initiating conversations. So the micro skills which are required for the socialization, like maintaining eye contact, exchanging smiles, proper posturing, they are also important part of the treatment. Occupational therapy, that is integral part of the treatment, wherein the therapist work in one-to-one setting with a child. They involve in playing games like catching and throwing for improving the coordination of the movement. They also tend to involve in other activities with the child, which overall leads to the improvement in the overall behavior of the child. Sensory integration therapy is also important, wherein we try to give sensory diet to the child, like deep muscle compression, or giving deep pressure to the child, or involving in physical activities, physical exercises, physical therapy, speech therapy. Apart from that, helping the child to involve in exercises in routine, which will help the child to channelize their excessive energy, like for example running, that can help the child to channelize their excessive energies. Also, there are classroom modifications, classroom interventions which are required, wherein teacher needs to give signals, warning signals to the child for transitions like a bell. A positive statement from the teacher can really help improving the behavior. Like for instance, instead of saying to the child, "Don't rock the chair," they could positively make a statement, "Keep the chair on the floor." Appreciating proximal approximation of the behavior of the child positively can reinforce a child to exhibit the desired behavior every time. There are lots of myths associated with the treatment of ADHD. There are different stimulant medications which are also available to treat ADHD, as people wear glasses to focus their eyes. Similarly, medications help a child to focus their thoughts and ignore distractions. They do have side effects which are minimal and short-lived, like disturbed sleep, loss of appetite, and social withdrawal. But medications, when given along with behavior therapy, gives amazing result. Just remove your inhibitions, gear up your spirits, look out for a professional help, take your child, seek professional help so that you can help your child at appropriate time with the help of proper intervention and treatment. Good luck.